brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back, everybody. Who among us here on Healthy Living Tuesday has not had bad breath? Everybody has at some point, but typically you can take care of that with good dental hygiene, as we're taught. But halitosis certainly is no laughing matter. It's actually a very serious medical condition. And the very lovely Dr. Jitka Lom, as we switch camera angles, she, of course, is with Express Care. Doc, thanks for being back with us again.
Thank you.
Okay, halitosis is something that I know when I was growing up with, the subject of many, many punchlines. But like I said, it is a very serious problem. So bacteriological in nature, I would assume?
Yeah, most of the time, halitosis is the medical name for bad breath. And most of the time it is due to bacterial infection in the gums, sometimes in the sinuses, or the tonsils.
Mm. And halitosis itself is, not to sugarcoat, and I use that term loosely and everything, but it's like bad breath to the next level and everything, and why? Right,
it's something that's maybe persisting. Most of the time, like you said, if you brush your teeth, your bad breath will go away, your morning breath. That's because you're brushing off the bacteria and rinsing them out. But like you said, sometimes people have persistent infections. It's basically something called a biofilm that means basically the bacteria are kind of stuck on in this sort of membrane, stuck onto your teeth, your gums, your tonsils, and it's really difficult to get that off with unless you actually scrub it or jet it off with like a water pick or that kind of instrument. Brushing it off, jetting it off, rinsing it off. These things are helpful, but they're sometimes hard to do because people can't reach all the way back there, or basically the film is very stuck.
Now I know one telling thing, a lot of people associate halitosis with if people have like white tongues, because they said orthodontists commonly tell you, when you're brushing your teeth, of course, you want to spend like a minute at least brushing your teeth from all angles, but then also don't neglect your tongue.
That is true.
Because that's where a lot of the funkiness comes from.
That's true, and even the tonsils, if you can reach back there. Of course, people tend to gag, that's the problem. So there's a trick to not gagging, and that's panting, just pretending that you're a little puppy when you're brushing your teeth, and that will help you to not gag. Yes.
Hopefully you don't do this in a public place like maybe a bus terminal or the airport.
Yeah.
That'd be kind of funny. I never knew that.
Yes.
Okay. But for people that have that, like white tongues and everything like that, are there any over-the-counter products that can maybe offset or come back? Because I know one of the things with halitosis, it's typically so persistent, it's very embarrassing for the bearer.
Yeah, and it is, and it affects their social functioning. Sometimes people won't come near them, and it affects their relationships with people. So it's important. So back to the tongue coating. The tongue coating is actually really very important. People that have diabetes or other health conditions, especially if they have like kidney failure or liver failure, they'll have a different tongue coating. So and if you're sick, you can look at your tongue coating when you have let's say a cold or a flu, you will have a whitish tongue coating, and that's due to congestion there, and again, overgrowth of bacteria. So you can brush that thing, and also you can use a little bit of mouthwash. Now you don't want to use the really harsh mouthwash. What you can do is just dilute it a little bit so that it's not burning your tongue and burning the back of your mouth, because sometimes the mouthwash is so strong that it's actually drying, especially if it's alcohol based. Some mouthwashes have a lot of alcohol, and they'll dry your mouth. By doing that, you actually make the bacteria grow more.
Now there is a difference, since you brought up mouthwashes, between the mouthwashes that are more fragrant or more cosmetic. Like I know some are specifically for, it says, freshens breath. Others, they actually say they kill the bacteria that cause bad breath and everything like that. If someone has halitosis, which should they be looking towards?
Right, so pick the one that says bactericidal. There's something called dioxime, Dioxime. You can buy that one online. That's the best one if you have a severe problem. But basically, if most of the mouthwashes are really strong, they can cause actually irritation. So choose one that's maybe bactericidal but dilute it up a little bit.
You talked about just a few moments ago about people with liver and kidney failures and halitosis being a byproduct of that. Does the onset of halitosis, could that also signal some more serious health concerns as well?
Yeah, certainly could. Certainly if somebody has an odor that just won't go away, it's something to really check out, because people can have tonsil cancer, sinus cancers, tongue or mouth cancers, especially if they're smokers, which is another cause of bad breath. If people are smokers, again, their mouth tends to be drier from all that inhaling and from the actual smoke itself, and they'll have overgrowth of bacteria again.
Is halitosis transmissible for, say, like, people that, and like,
From kissing.
you kiss and then you wind up passing it to the next person?
No, because most people would have an immune system that would kill off those particular germs, or their mouth hygiene would remove those germs again.
Okay, well, we have some great questions talking about bad breath and everything. You ready for these?
Ready?
Okay, well, stay tuned because we will be right back and we will talk about halitosis and how to get rid of it, hopefully, when we return after this.